Have you ever walked into the pharmacy and wondered, why the heck does this drug cost so much? You're about to find out. Hello everyone and welcome back to Happy Farm Life. My name is Dr. Sierra Richard. I'm a pharmacist dedicated to helping you live a happier, healthier life. And in today's video, we are talking about why drug prices are so high in the United States. The first thing most people think about when they hear high drug prices is big pharma. Yep, that is what gets blamed, that's what everyone says, and while they are a contributing factor to why drug prices are so high, the amount that you're paying in the pharmacy is typically not actually dictated directly by them. Your next answer may be your insurance company, and that's sort of correct. Your insurance company actually has a middleman between Big Pharma and your insurance company, and that is called a pharmacy benefit manager, or PBM. You may have never heard about them or recently heard about them in the news because they've been hidden for a while. See, this whole idea of a pharmacy benefit manager was to help regulate contracts between Big Pharma and your insurance companies, kind of serving as that middleman to negotiate contracts and hopefully have a better power to do so because they would represent multiple insurance companies and can get better contracts for medications. Sounds great, right? That was until somebody realized that there was no regulations on PBMs, meaning dollar bills for them going directly in their pocket and nobody stopping it. This is in super basic terms. I don't want to complicate it more than I have to, but basically, when you pay for a prescription drug, you are paying your pharmacy, so they get a little sliver of the price because they're filling the prescription and it costs money to do so. Your insurance gets a slice of it. The drug company, usually I have a contract, but depending on what the contract is, they may get a slice of it. And then the PBMs for negotiating said contract also get a slice of it. But over time, what happened, that slice that the PBMs got bigger and bigger, and the slice that pharmacies got smaller and smaller. And the cost that you paid for drugs also got bigger and bigger to cover that slice for the PBMs. The state of Arkansas recognized this, and in 2015, they actually passed a law known as Act 900, which was huge for patients and pharmacies, because here's what's been happening. What you don't see is that when you pay for a prescription at the pharmacy, right now, they are losing money on a lot of them. We're not talking an occasional basis where they lose a couple bucks. No, we're talking hundreds and hundreds of dollars, sometimes every single day, that is walking out of the door in your prescriptions, but that money is not going to your pharmacy that you just paid. No, it's going to the PBM's pockets. And your pharmacy is left with a deficit and losing money by filling your prescriptions that may be saving your life. Are you upset yet? I know I am, and it's about to get worse. Act 900 was passed that required PBMs to actually pay pharmacies at least the wholesale price, so the price that they are paying for the drug to give to you, so basically breaking even cost, or above, which is more appropriate because the price we pay for a drug is not the only thing that goes into your prescription. We have to print the labels, we have to pay the pharmacists and technicians to do all of the work. We have to pay for our computer systems, the internet, the lights, the ability to keep the rooms cool so we can store your meds. We also have to pay for the containers that we put your meds in, and all of the other supplies that is necessary to be able to meet regulations, fill your prescription correctly, the software that we need to do drug interaction checks. All of that comes into encompassing the cost of your drug. But right now, this was a win because we wouldn't be losing money on the drug itself, technically. We could still lose money on the prescription, but at least it's going to be breaking even on what we paid for the cost of the drug. This just covered the generic drugs, but it was a huge win. Additionally, another sketchy thing that had been happening was that PBMs that were affiliated with a specific pharmacy were paying that pharmacy significantly more money, reimbursing them much better than a pharmacy that wasn't affiliated. The biggest, CVS Caremark. So if you went to a CVS, the reimbursement for the same exact drug at your local pharmacy that was not affiliated with CVS was 3 times more for the CVS than that local pharmacy. Typically, that local pharmacy was losing money, and that CVS pharmacy was winning big. Act 900 took that ability away and said that affiliated pharmacies did not get better reimbursement than your local pharmacy. So in 2017, the Pharmaceutical Care Management Association decided that they were going to challenge Act 900. They took it to federal court and basically said that there are current regulations in place. I'm not going to get into all the technical names, but basically there were higher authorities out there saying that they couldn't be regulated. In 2017, the court ruled One, yeah, that probably was true, and the other not so much. So it still stood that Act 900 was legal and PBMs could be regulated. Obviously, the PBMs didn't like that so much, so the PCMA decided that they were going to challenge that district court in 2018 to see if they could get this overturned. And they did. It was actually said that there was regulations in place currently that prevented PBMs from being regulated at all. However, what regulations they were talking about were not state regulations. They were federal regulations, and that this court case actually affected every single state, not just Arkansas with Act 900. Because Arkansas wasn't alone in wanting to regulate PBMs. Other states had tried or have legislation, including my own state of Missouri, to try to regulate these organizations like insurance. So in October of 2018, Arkansas decided, hey, you know what? We're going to challenge this and try to bring it to the Supreme Court. And it was accepted. So we originally had a court date of April 27th for this to be heard. It's called Rutledge versus PCMA. Unfortunately, it was pushed back, and now it's being heard on October 6th. Basically, this is one of the biggest court cases that have happened in years, specifically for drug pricing. We've seen a lot of regulations fly around in the past few years about trying to cut costs for drug pricing and ways to do so, but regulating PBMs is a huge one and could make a huge impact on your bank account as an American. You may not take prescription medications now, but if you do in the future, this will impact the amount of money you will be paying at the counter, as well as for how much you'll be paying for a prescription drug insurance. So here's exactly what's at stake and why it matters. If the PBMs win, there is no regulation over what they do. They can charge whatever the heck they want. However much they want can go directly into their pockets. They will be able to charge more for a pharmacy that is not affiliated with them. So AKA, if it's not a CVS and CVS Caremark is your PBM, which you may not even know, then CVS gets more money than your local pharmacy over here, period. It doesn't matter that they're doing the exact same thing, filling the exact same prescription. So why does that matter to you as a patient? Well, first off, it takes away a lot of choice because eventually your local pharmacy can only lose money so much before they close. Local independent pharmacies are closing all over the country, and this is really important, especially for rural areas, because they're losing pharmacies, period, and now having to drive miles and miles and miles out of the way to get prescription drugs that could save their life. Or they're being forced to switch to mail order and not get to talk to a pharmacist, which can be very important, especially for new medications. You're losing that relationship that we have with patients, and that is critical for you. Well, I work in a hospital now. When I worked in a retail pharmacy, that pharmacist knew the meds that their patient was on. They knew them, and if anything looked a little odd, they knew it. But what it does for you is if there's no regulation on PBMs, nothing is stopping them for increasing that amount of money that continues to go in their pocket, which is coming directly from yours. Whatever is decided by this court case will directly impact how pharmacies function in the future and how much you will be paying for your drugs. So while you may have not heard about PBMs before and you may have not heard about this court case, it is huge for your healthcare and your future of healthcare, because if this is ruled that PBMs don't need to be regulated, drug prices will continue to rise. PBMs will still make money, local pharmacies will close, and the American people are the ones who are going to suffer the most. Rutledge versus PCMA. Keep your eye out, watch it, October 6th. It's going to be an important decision for all of us. If you didn't know this information, go ahead and hit that subscribe button below, because I will be dropping things like this all the time on my channel for you to know what's really going on with your healthcare. If you enjoyed the information I shared, please give this a like. That really helps support my cause, and comment down below if you're going to be paying attention to this court case or if there's anything that you would like to know more about this court case. Remember, I'm a pharmacist, I'm not a lawyer, but I'll do my best. I really appreciate you watching. Thank you, and I will see you later. Bye.